Hi, this is Casey Phillips, and welcome to my final Patho Pharm project. I will be presenting the topic of depression using a concept map here, as shown on the screen. So interestingly, depression is one of the most commonly encountered mental health conditions in healthcare. Additionally, patients who are medically ill are at a high risk for chronic depression. In other words, mental disorders are not exclusive to psychiatric facilities, and nurses should therefore expect to encounter and be prepared to care for these patients in any medical context. This makes the concept of depression a very pressing concern for nurses. The causes and risk factors of depression are not fully understood, which is why pharmacologic treatment has been so historically slow. However, a combination of biological, psychological, and cultural factors are the most commonly understood causes. So, for example, childhood or life experiences, maybe notable traumas. Genetics are known to play a factor, so someone is more likely to have depression when there's a family history. We know that gender and age also play a role. Notably, women are more likely to experience depression than men. However, men are more likely to commit suicide, and it typically impacts individuals in their 20s or 30s and the elderly population as well. A more notable cause of depression is associated with neurotransmitter deficiencies in the brain that are associated with cognition and emotion. And these neurotransmitters are typically serotonin, norepinephrine, and dopamine. And then some notable types of depression include situational depression, in which the depression occurs as a result of a life circumstance, postpartum disorder, which is associated with hormonal and situational stresses related to childbirth, seasonal affective disorder associated with the gloom of dark wintry months, and this is associated with enhanced release of melatonin because of a lower natural lighting. Psychotic depression, which is characterized by intense mood shifts and unusual behavior, depressive signs and lost touch with reality, hallucinations, delusions, and disorganized speech patterns. And some common signs and symptoms of depression, especially diagnostically for major depressive disorder, include difficulty sleeping, there could be sleeping too much, insomnia, extremely tired, low energy, abnormal eating patterns, which could be eating too much or eating not enough, some physical symptoms such as stomach pain, muscle pains, headaches, and then a low ability to concentrate or make decisions. And then there also may be feelings of despair, guilt, misery, just a general lack of self-worth. And then also a notable obsession with death, or the person actually expresses a desire to commit suicide. So upon assessment, the nurse should rule out any medical possibilities of depression. For example, thyroid gland problems or early Alzheimer's disease, because these are often associated with symptoms of depression. And once the physical causes are ruled out, then an appropriate psych eval can take place. So pharmacologically, antidepressants are used to treat depression, and therapeutic effects would be to enhance mood. So in evaluating all pharmacological treatments, we would want to evaluate for an increased sense of well-being, interest in surroundings, and just a general decrease in symptoms associated with depression. And before we get into the specific classes and individual drugs, a big warning about all of the antidepressants is that individuals on them should be monitored closely for signs of suicide, especially in the beginning stages of treatment or when there's a dose change, and also in children who are notably at a higher risk. And in general, for all types of antidepressants, the nurse would want to assess for suicidal tendencies, appetite and nutritional intake, serotonin syndrome, so some of these manifestations would be mental changes, agitation, autonomic instability, tachycardia, blood pressure changes, neuromuscular problems such as hyperreflexia and coordination, and GI symptoms, so nausea, vomiting, diarrhea. And then this is especially prevalent in patients that are taking other serotonergic drugs. And then for teaching, you would want to instruct patients to take the medications as directed. Also, to not stop them abruptly, as there could be some pretty serious risks associated with that. And also, these drugs may cause drowsiness or dizziness, so you would want the patient to avoid driving or doing any other activities that require alertness, at least until we are certain of how the patient responds to the medication. We would also want to, again, advise patient, family, and caregivers to look for suicidality, especially in the early stages. We want patients to avoid alcohol and to alert the healthcare provider of any over-the-counter medications or vitamins that could interact with these drugs, especially, for example, St. John's wort with serotonergic drugs. We would also want to inform the patient to use mouthwashes, good oral hygiene, and sugarless gum or candy to help with any symptoms of dry mouth. And if this persists for more than a couple weeks, we would want them to consult the healthcare professional regarding use of a saliva substitute. And also they need to be aware that it can take about 4 to 6 weeks to achieve optimal effects of these antidepressants. So first we have our SSRIs, which slow the reuptake of serotonin into the presynaptic nerve terminals. These are the preferred first-line drugs, and relevant drugs include Lovox and Zoloft. And common side effects include nausea, dry mouth, insomnia, headache, nervousness, anxiety, GI disturbance, anorexia, dizziness, fatigue, sexual dysfunction, and then some major adverse effects include suicidal ideation, serotonin syndrome, and Stevens-Johnson syndrome. And then we have our atypical antidepressants, which is a norepinephrine dopamine reuptake inhibitor. And relevant drugs here include Cymbalta and Wellbutrin. And some common adverse effects include dry mouth, headaches, insomnia, high risk for seizures, especially in the higher doses, sexual dysfunction, and suicidal thoughts. Next, we have our tricyclic antidepressants, which increase levels of serotonin and norepinephrine. And a notable example of this is Anafrol. And this drug is not recommended for cardiac patients or women that are pregnant. And some adverse effects include some GI effects, dry mouth, constipation, drowsiness, weight gain, sexual dysfunction, suicidal thoughts, and cardiac arrhythmias if taken in overdose. And then specific assessments here, we would want to assess the patient for orthostatic hypotension. And then finally, we have our MAOIs. These block the monoamine oxidase enzymes that break down serotonin, norepinephrine, and dopamine. And a notable drug here is Nardil. And this category of antidepressants are usually used as a last resort. They have many drug and food interactions, and patients taking this drug really need to avoid foods containing tyramine because this could cause hypertension, crisis, or a stroke. And you would want to teach the patients to avoid these foods. They would want to limit caffeine intake and also increase this increases the effect of insulin and to avoid alcohol. And a specific assessment here would be to check hepatic functions during prolonged high-dose therapy and then monitor, again, serum glucose frequently in diabetic patients as hypoglycemia can occur. In addition to drug therapy, non-pharmacologic treatments are suggested for optimal treatment for severe recurrent depression. Counseling therapies provide verbal interactions with a therapist that may help build insight, and then behavioral therapies help patients unlearn patterns in behavior that can contribute to their mood shifts. Also, short-term psychotherapies for some forms of depression include interpersonal therapy, which focus on relationships that may be contributing to the depression, and then cognitive behavioral therapies, which help patients change negative thoughts and thus behaviors related to depression. Psychodynamic therapies are often used after the depressive symptoms are resolved and help the patient confront internal conflicts. And then ECT, which is electroconvulsive therapy, is a very useful treatment and has the highest rate of remission of any form of antidepressant therapy. And depression impacts individuals of all cultures, but open discussion about their symptoms and potential therapies will differ from case to case. Their openness varies. So, for example, age, gender, and culture all play a significant role, and there is a notable stigma associated with mental health, and patients sometimes will hold back in discussion, which may hinder the nurse understanding the patient's symptoms and can negatively impact patient care. In many cultures, depression isn't even seen as a mental health problem. Therefore, patients often will discuss symptoms of depression through physical symptoms in response to their emotional distress. This is called somatization. So it's really important for nurses to listen closely and assess for these slight signals, such as physical symptoms, that could indicate an underlying depression problem. In communicating with culturally diverse patients, it's appropriate to ask the patient their cultural meaning behind symptoms. And it is really important to avoid stereotyping in order to provide optimal patient care. In conclusion, depression affects 264 million individuals globally, and it's considered to be one of the leading causes of disability worldwide. Although it's common, depression is a serious and often debilitating condition. Untreated depression, especially long-lasting and at moderate to severe intensity, may, as we've discussed, have negative impacts on almost every aspect of a patient's life. Disruptions in functional abilities may impair work or school performance and psychosocial relationships. And in many undiagnosed and unmanaged cases, depression may have fatal consequences and is considered to be the leading cause of suicide. Appropriate treatment for moderate to severe depression is often highly effective, and it's important to understand these risk factors, signs and symptoms, and options that are available to help these individuals. So, for more information, I recommend visiting the World Health Organization source that I have provided in my references. And you can see it is the 6th resource that I have on my references slide. Thank you very much for tuning in, and have a good one.